Hello everyone. Today, let me share with you all the good and damaging effects of anxiety to many of us. How anxiety and fear put someone in an everlasting cage in prison. How anxiety separate us from reality and fear. But first let me introduce myself to you all. My name is Jordia. I'm a Filipino-American registered nurse, OFW, a traveler, and the founder of Care to Heal and Travel Doves channels. This video is brought to you by Care to Heal channel. Please support my channel so that I can continue to create educational videos like this. Kindly like and subscribe bro. Well, fear and anxiety are natural feelings. Instincts that make us react on certain life events. Some individuals may have controlled reaction and response. They can keep themselves composed. On the other hand, others may have a radical and debilitating response to these life events. It is commonly known as anxiety. Let me share to you the story of my sister. Several months ago, my sister said, "I am anxious to start a new job." More than a year ago, she quit working as a registered nurse so that she can focus on healing herself from this debilitating anxiety and fear related to COVID virus. She got infected from work, resulting into hospital admission and oxygen requirements several weeks after hospitalization. It was a long and tough healing journey for her. Taking supplements also became a good mind support for her immune system. Briefly, let me tell you a summary of who is my sister. My sister is one of the most humble and hardworking registered nurse I know. She is compassionate and caring to all her patients. She treats every patient as her family member, and starts each day with smile and contentment. When she delivers care, it is full of honesty and optimum quality. When I was a nursing student, she became one of my clinical instructors in mental health. However, she decided to stay in bedside care instead of nursing leadership. If you remember in my previous blogs, I mentioned that my mother wanted to become a nurse, but was forced to take BS Commerce by her older sibling. To fulfill my mother's dream of becoming a nurse, 3 of my siblings and I became registered nurses. We are a family of registered nurses. Many of us, when we hear scary news or engaging into something completely alien to us, we become fearful and anxious. Some of us reacts by saying a prayer or thinking optimistic outcomes. These defense mechanisms seem turning everything fine, balanced, and anxiety controlled. But for others, it may not be the same positive outcome. There are 2 general common effects of anxiety in some individuals. First, the good effects of controlled anxiety and fear. Makes you value your achievements in life. Second, it makes you humble and contented. Third, it keeps you safe. Prevents unnecessary harm. Makes you recognize happiness in a simple way. The other part of anxiety causes debilitating effects. Uncontrolled fear in everything new. Doubtful and suspicious. Isolation and loneliness. Making unreasonable decisions such as declining simple supportive measures. Feeling unwell and unworthy. Abnormal vital signs such as tachycardia or increased heart rate. Hyperventilating or rapid breathing. Feeling suffocated and wanted to explode. Wanted to jump, run, scream, and cry. Refusal and fear of taking medications. My sister fought hard to defeat these debilitating effects of anxiety. The full support of her immediate family, relatives, and friends were needed. Mind support supplements played a good part as well. Hobby diversion and making herself occupied was necessary. It was a big help on her condition. During summer, she does camping, fishing, and gardening with her family. In wintertime, she does painting and singing. If my sister can change and defeat these debilitating effects of anxiety and fear, you can too. It is not too late for you to change your life for the better. Do not let fear and anxiety control your life. Be the controller of your life and head for a positive direction. Do not let yourself and your family suffer. Start the change and start living a productive life. Thank you, my loving sister, for letting me share your story. See you in my next blog. Big bucks. You're a nurse? You live with luxury because your income is above average. I heard these comments many times. From people with different status in life. Elite people, average person, and more. I just always respond with a smile. Nursing profession is a unique profession. Intensive and requires hard work. As I mentioned in my previous blogs, to be a good nurse, you must be dedicated, motivated, honest, and full of compassion towards others. You cannot be a nurse if your main professional career driving objective are high income and salary. Below are some of the challenges nurses encounters in many aspects of life. First, to self and family. Challenges such as working on holidays, weekends, and birthdays. A nurse cannot celebrate all the holidays with their family in person. Either Christmas Day or Thanksgiving Day. Spending nights and weekends away from your loved ones. Not enough sleep. Often under stress emotionally and physically. Being unwell and still needs to care for others. Yourself, the family and loved ones are always second. Prevention of bringing any disease at home. Strict compliance with health laws and regulations. A nurse is required to be updated in current nursing practice, rule and laws. Must adhere to the institution policies, the state health regulations, and national laws. Active and current licenses and certification renewals are mandatory. Renewal fees are not cheap for sure. Updated nursing practice is also a critical aspect. Each nurse must attend in-service training to keep their nursing skills up to the national safety standard. Classes that teaches nurses how to operate medical devices and supplies. Nurses are mandated to complete annual seminars and courses such as corporate compliance and nursing procedures. The continuous education and learning are necessary. Magnet specialty certification must be taken and renewed to keep your competitiveness and self-marketing advantage for job opportunities. Devices and care equipment updates is another factor. Continuous learning and education credits are required for a nurse to renew their certifications. Having specialty certification increases the chances of work promotion. The worst challenge of nurses are patients who are aggressive, mentally challenged, and homicidal patients. Nurses mostly becomes the target objects of these patients. It is not unusual that nurses are being abused physically and verbally. Physician examines these patients for a short period of time, but nurses implements all the medical orders. When a patient is admitted in a hospital, nurses are with them 24/7 to render care. Many nurses were hurt and injured by patients at work. Some nurses were killed and some became disabled for the rest of their lives. So, what do you think? Earning big bucks versus the challenges. Is it worth it? Becoming a nurse is not just because of money. To be a good nurse, you must have the dedication, compassion, love, and patience towards others, regardless if they are two-legged or four-legged patients. Kudos to all the nurses and healthcare providers. Thank you for watching. Please like and subscribe below.